So let's take a look at some of the tests that do fall within a CCMA scope of practice, meaning that they are CLIA waived, easy to perform, and easy in being able, or I should say non-complex, and being able to obtain the results. So starting out with our glucose. Now, glucose will fall under a capillary blood test. It can be done fasting or non-fasting. And with glucose, we're obtaining a patient's blood sugar levels. Next down, we've got the PT or the INR. This is a coagulation study, checking to see how one's platelets are working. Usually for patients who are on blood thinners or maybe going in for surgery, it might be necessary for the doctor to have an analysis on how this patient's clotting works or how their coagulation works in their blood. Going down, we have the cholesterol testing, very similar in how we test for glucose, but here we're testing for total cholesterol numbers. Now with hemoglobin, we're looking at the patient's blood count. We're counting the red blood cells, being able to diagnose for anemia. And hematocrit, packed red blood cells. If the levels are too high or too low, it can indicate a disorder of dehydration or other medical conditions. Here we have the PKU test. PKU is done on newborns, usually before they leave the hospital, looking for a hereditary disorder that has to do with how the baby metabolizes. If this is left untreated, it could lead to intellectual disabilities, seizures, behavioral problems, as well as mental disorders. And you can see here that it's done using a heel stick and a special filter paper to be able to absorb the blood contents. Moving over, we have the hemoglobin A1C. Hemoglobin A1C also used to monitor individuals that are diagnosed with diabetes. And lastly, there we have the monotesting. Monotesting, this is a rapid test used to test for mononucleosis. Mononucleosis, we know, is derived from the Epstein-Barr virus. Notice here, we've got a mononucleosis test here, very easy in being able to obtain the results, going to give you either one line or two indicating positive or negative. And again, just requires a very, very small blood sample from the patient.